fired, you're just in trouble.
What do I do now?
Didn't remind me to record.
Oh, record, Lou.
Got it. Thanks for the reminder, Rosie.
No problem, anytime.
Good job.
All right. Remember in the patient assessment that we went over, we talked about the scene size up, and then we talked about the primary assessment, and we said 3-3-1, right? What's the very first component of that first three?
The general impression.
The general impression. And how should we think about the general impression?
An oh shit factor.
The oh shit factor. So you show up on a call, you get out, or even before you get out, you see the incident. This is where you see that oh shit factor. It's most likely a multi-systems trauma incident. So be thinking about everything, think about the mechanism, and part of your orientation when you move on to the level of consciousness is, do you remember what happened? So keep that in mind. Think about the mechanism and ask your patient what happened. If there's a vehicle accident, all right, how fast were you going? You should project like 10, 15 miles an hour or add 10, 15 miles an hour to what they said. All right. Any questions on multi-systems trauma?
What did you just say, Lou? You said you add 15 miles?
Okay. Come on. You think you're gonna fess up that in a 55 you're doing 85?
Right. I got you.
Oh, that's 30 miles, but
yeah.
You usually want to add. Like the semi accident I went to on Friday. The guy said he was doing 68. Like, I don't think so. I think you're going a little bit faster. So, all right. Questions?
No.
No, sir.
All right. So, Paula is pregnant. And Paul is driving. And Paul goes boom. Why would trauma to a pregnant patient be a concern?
Because of the fetus.
Okay, so we have the fetus in there. And so we got to think about the bigger uterus. We're concerned with a uterine rupture as a result of a compression injury. Remember, like a lung can pop? Well, we can rupture the uterus as well. Now, does a pregnant woman's blood volume increase?
Yes.
It does. How much does it increase by?
You said the blood
Yeah,
by 25%?
or 40 or 50%. So, in other words, how much volume does she lose before she's showing signs and symptoms of shock? That 40 to 50%. So is that a lot of blood?
Yeah.
Yes.
Yeah. Do pregnant women waddle?
Yeah.
In other words, walk like penguins. Yes. Right, Rosie? She's ignoring me.
No, yes.
By the way, guys, understand this and accept this now. It will make your lives a lot easier. It's all your fault. Okay? The condition she's in, it's all your fault. Didn't matter that it took 2 to tango. It's your fault.
Lou, what chapter we in?
36.
Okay.
Fine, let me do that.
What?
Upload the chapter.
No, I was just asking.
Yeah, but I know what's coming later.
True.
What do you mean that? All right. So, yeah, because of that waddling of they have a different center of gravity, and so they could lose their balance. Again, it's sticking out. Not a lot of room in the front of the car because of their expanding gut. Which, again, guys, whose fault is it?
The lady's fault.
It's the lady's fault.
Hell yeah.
Yeah, they wouldn't have lured us with their look, right?
Oh,
Yeah,
yes, they
exactly.
Come
must.
hither, look. Oh, you should see the look that Sequoia is giving right now. Somebody's in trouble. And I have a feeling it's me. No, but remember the fetus, as the fetus grows, it sits higher, the diaphragm goes higher. Blood flow to the kidneys increases because more blood is available. So pregnant women can present a problem in more ways than one, come to think of it.
Hey, hey.
No, I'm talking about trauma-wise and medical-wise. I would never say anything bad about you ladies. She didn't buy it, did she?
No, 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 no.
You might watch out, Lou.
What was that?
You might watch out. She's not in a great mood right now.
Rosie's
She's
not in
really
a great mood. I gotta figure out how to cheer her up.
I'm good with food.
I offered, you didn't want any.
True.
Um, I was trying to remember what I was gonna say here. Trauma. If it's affecting the mom, is it going to affect the fetus?
Yes.
Yeah.
Yes.
Yeah.
So we really have two patients to worry about. We have the mom, and then we're going to have the fetus, because where does the kid get their food from? Or their nutrients?
The mom.
Mother.
From mama. Yep. See, it starts at very, very young age in the negatives. Mom, I'm hungry. Mom, I'm hungry. Right, Rosie?
It's annoying.
But the kids are mean.
We're getting looked at ugly.
As far as musculoskeletal injuries, we do have to worry about that, the falls and things like that. But it's more so the cardiovascular because of the volume. We have to worry about the higher blood loss to be able to see anything. But also it's affecting the fetus because, again, the fetus is getting its oxygen, its nutrients from the mom via the umbilical cord, via the blood, the maternal blood. So things to think about. We talked about uterine ruptures. The abdomen's right there. You get compression of the uterus, you have a uterine rupture. What's that uterine rupture going to cause?
Internal bleeding.
Internal bleeding, which in turn.
No.
Question.
Yes, ma'am.
Chapter 36. It's the multi, right?
Yeah, multi-systems trauma and trauma in special populations.
You sent me the PowerPoint for a different chapter.
I didn't send you 36.
You sent me muscular, I can't even say it, injuries.
I did.
Yeah.
Oh, I sent you the advanced EMT one. Hey, so now are you going to be ready for that class August 11th?
I'm thinking about it. I'm down.
I'm just wondering if Paul and Sequoia and George and Luis are going to follow you.
Oh yeah, I am already.
I'm thinking about it as
They
well.
have no choice.
Out for it.
Damn, you guys didn't have any choice. Y'all are going.
The boss has spoken.
Yeah, she
Man,
did.
Paul is like really quiet today.
Hey, oh yeah, I'm here.
He doesn't want
I
to
know,
get
I see
bullied
you here. You're
today.
just there, but you're not even like, no comebacks to Sequoia.
He's grouchy.
I'm not grouchy. I'm tired. But you're not gonna tell me what I need to do. How about that?
Damn.
Oh, wow. All right.
I
Wait
think
till
it's
we
gonna
see
get
you.
worse for Paul.
Speaking of seeing you, so you got who's coming in tomorrow? Or actually, I should say, anyone not coming in tomorrow? I think I heard from.
Wasn't there like 3 people that weren't?
I don't remember. Oh yeah, you were telling me that there was a couple.
I'm coming, so I don't know.
Where have you been? What class have you been going to? I thought you've been set up for the morning class. Which one are you going
Me?
to? Yeah.
I was, but I've been going in the afternoon. But since they took
Oh,
the
okay.
afternoon class away, I'm gonna have to start going in the morning again.
Oh, yeah. I was asking about you the other day because you had set up for the morning, so we never saw you.
I saw him. Had 2 people show up for the last group.
Oh, that's good.
It wasn't really for them because everybody else had been there a long time.
Oh.
So they kind of just came in and helped out with the other group, and then it's like, okay, you're done. Tomorrow, remind me, you guys got to get your N95s for your ride-alongs.
Sounds good.
You'll be issued 3,
Gotcha.
and then you'll get a piece of paper that talks about it, even though Christina put it on Teams, but it's on there. I'll give you a sheet of paper. All right. So going back, so injuries to female, pregnant female can be dangerous, not only to the mother but the fetus as well. So we talk about compression. How about stab wounds?
Yeah.
How about I remember I had one guest of the West Texas Detention Center, which is a federal prison out in maybe it's a prison, jail, detention facility out in Sierra Blanca, and she was going to the hospital. I forget what she had. Maybe it was a seizure, but her, I don't know if she called him her ex-boyfriend or her boyfriend or her husband, one of the significant other. While she was pregnant, he kicked her in the stomach. I think the baby was born premature as a result of that trauma. So think about the impact. Think about the mechanism in that case. I mean, any guy that does that to a woman needs to be castrated and shot. And then some. Just left out in the desert. There's plenty of places to bury bodies out there. Just kidding. It's recorded. I'm playing off the Las Vegas where they say there's a lot of places to put bodies in. And there probably are a lot of bodies out there. What if you get, let's say, a traumatic event, and it's a pregnant female and she's in cardiac arrest? What do you do?
You
Just
continue
let her
as
go?
a regular.
What's that?
You continue as a regular CPR.
Yep. Yeah, try to keep that fetus alive. If the mother's not going to be viable, at least try to keep the fetus alive. So how do you take care of a pregnant woman? And don't say satisfy her cravings.
I say, well, I mean, depends on what situation.
Okay.
Tell her mom to take care of her.
Something like that.
You know your ass is grass, right, Paul? I would recommend not coming in the morning tomorrow. That's all I gotta say. Right, Rosie? Right, Rosie?
Sure.
Rosie, you better not say nothing. You better not say nothing.
Or what? What you gonna do?
Yeah, Paul. What are you gonna do?
Oh gosh.
I got you, Paul. Don't worry.
Oh hell no! You're not
That's what I'm
involved
talking
in
about.
it.
I got my boy.
That's
It's
what I'm
early for
talking
this
about.
shit.
Oh, well, watch your language. Don't make me
Or
go over
what?
there.
You ain't do shit. Shut up,
All right.
Luis, you too.
Yeah,
So-
no, I'm still laughing.
When till we
You
see
can
you
continue.
tomorrow, Luis?
Not worried.
Mm-hmm.
That's what I'm talking about, Luis. That's what I'm talking about.
Shut up. Pipe down.
So, Kaya, do you hear anything?
Oh, is that static in here?
I think it's the dog's barking again.
Ooh.
Rough.
I think that was a little poodle.
Is that what it was? We can continue, Lou. It's not this minutes nonsense.
Well, no, it's a great time filler because I'm trying to pull up my whiteboard. All right. So, I asked you guys about treatment for a pregnant woman. You guys weren't very specific. There's something you have to understand when you're transporting women.
You would put her on the
The
left
right
side.
side.
What?
Wouldn't you just place the fetus to the left side or lay the mother on the left side?
Why?
To relieve the inferior vena cava. No?
I'm trying to draw here. Gosh, we'll do purple. So there's the inferior vena cava. With the baby on the right side, what it does is it compresses the vena cava. So what happened to the blood flow going back to the heart?
It returns.
It decreases it. It says decrease, believe it or not. There, better? Since the E's not coming out. So what do? We put her on the left lateral recumbent. It takes the baby off, like Rosie said.
To
So
prevent
that's why
the
mothers. What was that?
To prevent the hypotensive syndrome.
Yeah, but it's called something else. Oh crap! What is it called? I always say what it is. Right now, I can't think of it because you guys burst my bubble. I was so excited I was going to teach you something. Supine hypotension. I think is what it is. I can't think now. I'm bummed. Okay, never mind. But yeah, exactly what you guys said. You definitely want to position her on the right side. So, all right. I'm sorry. Position her on her left. Even back my screen. Yeah, it is that supine hypotensive syndrome. What else? What else are you going to do for treatment of this trauma patient? So you position her correctly, left lateral recumbent. What else?
High flow tube.
High flow tube, 15 liters of non-rebreather.
Have a suction ready.
Looking into your soul, Rosie.
I don't have one.
Ain't that the truth? I mean, nah.
Don't worry, I don't have one either.
What else? What else?
The suction.
Okay. ¿Algo más? Kevin,
fine.
what else are we going to do for this trauma, pregnant trauma?
Assess circulation and check for bleeding.
Okay, we've already taken care of circulation and breathing.
No, check for bleeding.
Check for bleeding. Where? How?
Like check for vaginal bleeding.
Okay. Anything else?
Check for edema
Okay. Where?
on the pedal.
So pedal edema. Why would that be a big deal?
Because they're retaining water.
What else?
That means their blood pressure is high.
There you go. We got to worry about, and we'll talk more about it when we get to pregnant women and how annoying they are. I mean, the complications of dealing with pregnancy.
I feel like Paul's going to say a smart ass remark.
I don't think they have to
Paul
be
knows
pregnant.
better. I don't think he'll do it.
Well, I was gonna say like how they are when they're on their menstrual cycles.
You know, it's a funny thing. I had a student call me yesterday, talking about class and whatever, and she's telling me about her day. And then she says, "Yeah, I'm not in a good mood today. It's my time of the month." And I'm like, man, she feels really comfortable talking to me if she's gonna tell me it's that time of the month. Okay.
Oh,
I'm telling you, I hear a lot of stuff. I don't mind it. Just interesting that somebody feel that comfortable with me already. All right. Any questions on pregnancy?
No, sir.
Okay. So the main thing with trauma, pregnant trauma patients, is the fact that you have a second patient to worry about. We talked about the circulation issue. We got to think about the oxygenation issue. That fetus needs the blood, needs the oxygen in order to stay alive. So we got to think about any type of injury to the abdomen, as well as anything that's going to interfere with the airway and breathing. I'm sorry, with breathing and circulation. You want to make sure that you check vitals. Understand that the blood volume has increased, so they can lose more blood before they start showing the symptoms of shock. So keep that in mind. Start treating them for shock early on. Most pregnant women, whenever they're involved in an accident or suffered some sort of trauma, they do want to go to the hospital. There are those rare exceptions, and you kind of have to wonder what kind of mother they're going to be or they are when they don't want to get checked out after suffering some sort of trauma that involves the abdomen. But regardless, we have to keep in the back of our mind. So provide the best care possible to both the mother and the mother to be and the fetus. Okay. Questions, comments?
No.
All right. So let's do this. We're ready for the next section, which is pediatrics. But I think this is a good place to take a break. So I have 9:51. Let's be back at 10:10.
Sounds good.
that's fine.
Work for you guys? Alrighty then. I'll see you back at 10:10.
All right.